So today I was asked to kind of bring forward some dialogue and discussion about returning to the practice. Before I get started, I do have to say, right, in our discussion today, this is the best direction that we can provide as of maybe even this moment. I hope at least to be able to say date. Early on when we were busy educating and supporting organizations across the area, is that we would have our facilitators facilitating a webinar, and then somebody on the back end monitoring, if you will, all the legislative web pages just to see if anything was changing quickly and rapidly. And many times at the beginning of a call and presentation to the end, there was something that we brought up. So we are all moving very, very fast. And maybe this hour is a way for you to take a little bit of a break as well. And of course, another caveat is the fact that anything that is being provided in the way of information is not legal information, nor is it medical, right? ERA is a group of HR experts, and that is where our area of expertise lies. However, we can't talk about COVID and keeping people safe without probably talking about legislation and our favorite CDC guidance. Because when I look at what I had planned out for us, right, was creating a safe working environment, and more from the employee perspective than the patient perspective. I will share that I've been living COVID on a lot of different levels over the last 5 months. And so some of this will be professional thoughts and advice. Some of it will be what I have experienced. My husband started the COVID clinic here in our community 5 months ago. And so we've been living COVID on lots of different levels. So can understand and have experienced many of the issues that you guys are going through. And one of the things I want to take just a little bit of time on, in addition to creating a safe environment, is a healthy environment from a mental health standpoint. And, besides being an HR practitioner, I'm also years ago was a social worker. And if you're not taking care of the heart and the soul, the mind has a hard time following, and thus physical health. So just a little bit there to make sure that even in difficult times, you're contending with issues of your employees and what they're presenting. And then we're going to talk about some of these specifics that you guys have brought up and what I'm going to call hiccups, bumps in the road, and hopefully temporary more than permanent as we work through this. So and we're going to call it reopening, and I know that you guys are all in different phases of that reopening. My hope, first of all, is that you created a team, whether you call it a COVID-19 workforce or a group of people that was not just you alone, right? In understanding and gathering information from resources and advisors so that you have the best information that you possibly can have in making decisions. We talk about, and so there's 3 C's, right? Creating a COVID workforce, creating an exposure plan, and then communication. And those are going to filter through our discussions this morning. From the 3 P's, right, what this workforce kind of focuses on is protocols, procedures, and policies. And, the question is how formalized you have become. Have you been able to spend the time to write things up in policies, or at least have you implemented procedures to know how to handle various situations that you may come across? One of the things that we've seen employers work through, and granted there's a finite amount of money, right? But to move from a non-discretionary bonus structure to a discretionary bonus structure. And, that again, discretionary means, especially with your hourly workforce, that you don't announce that prior to providing, but, when and if and you can, that whatever that definition of substantial money is, right, is to try to offset some of that pain that somebody was making, if you will, $1,200 a week when they would usually be making $800. And look how hard I'm working. And and again, you may not be able to make it up for dollar, but it probably from a long-term retention standpoint is one of those things that we reward who produces, right? And to do that through a discretionary process. And I think the gift cards are great. Absolutely, that personalized thank you note handwritten by the physician can carry a lot of weight, but it's hard when you're looking at the pocketbook, right? So, the hope is, and again, it's just one of those things we won't know is whether or not, and it doesn't feel like we will, but if Columbus gets to purple, right, or Ohio gets to purple, what that might mean for us again. And so, even that decision's hard, right? Because the $600 has gone away. We don't know if it's going to be any amount of replacement for the additional unemployment. Governor DeWine has said that Ohio can't afford the match for unemployment. But certainly one of those thoughts is the ability to, can you take those people who were not off last time and have them be off? Or another procedural process thing to consider, and again, not sure how it works in real life in each of your practices, but to do a rotation is you're on 1 week and you're off the next. And that means when you're off because of COVID, right, then you're off and getting whatever benefit is from the previous week. And that's one of the things I think we learned from doing a staggered work is instead of saying you all are going to go away and be off for a while, is to say, okay, maybe next time around we do rotation and look at what that might look like, so that especially, and I heard this a lot, with the hourly workforce and in healthcare, the fact that it wasn't really fair that Mary got to be home and get an extra $600 every week. So, that's one idea. And again, I don't know how much this impacts you, but even travel, and I know we're going to talk about travel for personal reasons. Did you guys put any plans into place? Do you have staff that use public transportation? And even considering something like that? And granted, the bus systems are supposed to be lowering the amount of ridership, right, and physical distancing and all those kinds of things. But even something like that, as to the fact that what's the risk of somebody using public transportation to get to your office? So again, that exposure response plan, and obviously you guys have gotten really good at that, not simply for making sure that the office is as safe as possible, right? But what to do when somebody is exposed. And then through all of that, making sure that we're communicating. So, the first thing we do is looking at protecting the team. And OSHA has come out and basically said, right, you need to do a risk exposure, and had given us some guidelines as to what level risk different types of businesses are, and healthcare offices, the offices themselves come out at typically a medium level. And so in talking and looking at the things that an organization, a practice can do, is looking at two issues: physical changes and administrative changes. So let's take a little bit of time to talk about how you've changed your physical structure. And again, I know sometimes this is office specific and size specific, and maybe back to the supporter of today's program and having enough space, is what have you done to create barriers, safety barriers in your organization? And so, there's obviously some heartache, and somebody mentioned, how do you contend with that patient who even refuses to come into the practice with a mask, right? And one of the key things, and I don't know what your strategy is, but what I recommend is that frontline person who is making $12 an hour is not the one that handles the patient, right? That there is a process in place that they call for you. You know, you work, or whoever that leadership person is, handles that confrontation in the scheme of things. You know, I mean, even making sure that patients are calling from their car that they're ready, and that you can call them in when they're ready. You know, my husband had a patient situation where the patient knew they were ill. And in our discussion with each other, I'm like, are you guys not calling your patients beforehand to ensure that, you know, they're getting a reminder of the appointment electronically? Why not add in, you know, the verbal reminder that if you're running a temperature and not feeling well, that you should not be coming to your appointment. Now, again, a little rub if, you know, I might have the flu versus COVID, but the risk that that in that situation, that patient who actually ended up testing positive was putting at risk of the office personnel, as well as maybe any other patients in the practice that day. So, you know, some things that we're seeing for creating barriers is also different entrances. Remember, I'm coming from your HR, from your staffing standpoint, is that your staff, and they may be already doing this, but entering in through a different location than where the patients are entering into. You've talked about seating arrangements in the lobby, right? What does that look like for your staff, right? If I look at my husband's office, the MAs all share a communal workspace, or at least originally did, right? And so, you know, what they have done obviously is to make sure that there is significant distance between their seating arrangements and how they even exit and enter back into where their seat is, if you will, to make sure that there is at least a less of a risk of contact between staff. You know, another example is limiting equipment sharing. You know, the scanner, the copier, the phone. You know, identifying that, again, keeping your staff safe is limiting those multiple communal uses of equipment. You know, so kind of takes us back, if you will. Remember that office thief who always stole the good stapler, right? And so then everybody ended up putting in, you know, in a little label maker, put their names on it, kind of thing. I mean, it's almost, that's really a good practice at this point, right? To understand, you know, for your patient, it's for those that are not, you know, don't have the medical record, the EMR process set up, right, is the clean pen container and the dirty pen container. I went in for an appointment for myself, and they use a stylus on an iPad with the clean and dirty pens. And so we did that, signed in, whatever. And then they handed over, you know, if you will, a tablet with a stylus. And I'm like, not to be difficult, but has that been cleaned before you had me touch it? You know, so again, walking through all those kinds of looking at that shared information, you know, and reconfiguring spaces, right? I mean, we talked briefly about one-way hallways, right? You know, and again, don't know if it's physically able to do, but the importance of, you know, where is the entrance and the exit, you know, making sure that people who kind of creating what the sports and basketball and baseball have done, more so basketball, is those bubbles, right? Is to try to, where at all possible, those people that work together, keep them together and keep separated from someone else, from that cross-contam risk, if you will. So another popular kind of conversation is those communal areas, right? The kitchen, the coffee pot, the water dispenser. What have you guys done in looking at those communal issues?
Right.
You know, and, you know, again, a lot of just the internal process and move to Keurigs and those kinds of things. You know, some organizations have just said, we're removing all of those, you know, anything that you bring, you need to bring for yourself. You know, and even the shared refrigerator, right? Is if, you know, 7 people touch that handle and one person may actually be infected, right? Oh my gosh. And then I go back and look at just the general openings of the doors, right? And whether that be the bathroom doors or the entrance to the to the facility, you know, and I think, Dana, you brought up a really good point is, and I don't know if you know you said this, but demonstrating the behaviors. And you talked about the cleaning rituals that you guys were going through, right? You know, and I heard this yesterday on Governor DeWine's press conference with the schools, and one of the I think it was Children's in Cincinnati specifically called out that children watch the behaviors of those adults in their lives and will acclimate to those behaviors. And it just reminded me again how we have to demonstrate, you know, the behaviors that we're looking for. So, you know, again, things to look at from the administrative side is whether it's for the patient or the employee with social distancing, which is incredibly hard, right? The MA pulls back the patient into a room and needs to take their temperature and blood pressure. Don't think you can do 6 feet, right? I mean, that's just not that's not a possible feat. So obviously the PPEs, and then you know, the antibacterial cleaning and hand washing. You know, I always thought before when I would go to the doctor, and my doctor, they have, you know, a sink in the patient room. I always thought it was such a good demonstration to me that they would wash their hands in front of me, and then they would wash their hands in front of me before they left. And again, those are just great practices. So are you all taking temperatures upon entry of your employees and
Yes.
doing a health assessment? Okay. Very key. You know, I wish we lived in a world where people would be responsible and know they didn't feel good and wouldn't come to work, but that's not the world that we probably live in. You know, especially even with the FFCRA, right? Lunchrooms, right? Again, really important. That thank you, Dana, for doing what you guys did and giving up the boardroom to make sure that people have the ability to be social, but the ability to have those in small groups. So you see travel here, commuting and travel. So let's take a moment at this point and talk about the question of the travel restrictions. So currently in Ohio, it is not an order, it is an advisory for travel. And so that if an employee would make a personal choice to travel out of state and return, it is advised that they then self-quarantine for 14 days. Or 10, depending on who you're listening to, but in that upon their return, because it's an advisory and not an order, it's not protected under the FFCRA in the way of being able to be paid for that time. So I think you have to evaluate the risk. And this is, again, it's kind of something unusual that you hear from an HR person, is case by case. Evaluate where they went, what they were doing, to make the determination that they know in advance that if they leave the state or travel from Columbus down to Cincinnati, that, you know, there might be some things that from an administrative standpoint that you have to do, i.e. make sure that they don't return to work. So you can't say you can't go to Arizona. That would not be something I would recommend, right? But what I would say is that if you elect the decision, you make the decision to go to X, that upon your return, then you'll be needing to use an additional 14 days of PTO. And health and safety requirements, obviously, expecting your staff to tell you when they don't feel good that it's okay not to come in, you know, and probably one of the things that we've seen, and I don't know where you all with the healthcare situation and practices are, but making sure that your team knows that if they have a concern, to report it, right? And then you actively investigate and review whatever words you want to put around that to be able to, again, reinforce we care about you and we care about your safety. And, you know, part of that communication then also is making sure that people know the expectations up front, what's changed in the way of our policies and our procedures, et cetera. So just quickly, because it's, oh my gosh, only 15 more minutes, is the mental health side of this, right? I mean, we know that the US is now up to over 5 million cases since COVID started, whatever date we're using as to when COVID started, you know, and, you know, as crazy as these numbers look, what cases versus averages in the US, right? We can go on the CDC website and we find these numbers, right? Is that, you know, healthcare deaths for the providers is 600, and that causes fear, right? In the day that patient that came in that was sick, right? The first person at the front desk who greeted her, right? I had a mask on, you know, but there was immediate fear because there was no doubt that this person was COVID positive and eventually tested positive. You know, and fear drives our emotional health. So when we look at some attention that's been paid to this over the last 5 months, right, is that we're seeing an increased amount of workers who are reporting stress. And this is a Ginger survey that was done in April and May. You know, 69% of employees are saying this is one of the most stressful times in their professional career. And that stress has actually resulted in physical issues. You know, so we can't ignore, we talked a lot about the physical, but we can't ignore the mental health issues and the things that we can do as an organization and as leadership, right, is to basically, and you know, you're going to ask me, where, Monique, do I find the time? You know, but to spend the time to demonstrate and to be empathetic and to understand and to have lots and lots of one-on-one conversations. And whether that be from, I understand and let's work through this, to the coaching component, right, which, you know, is valuable if, you know, somebody's having difficulties. And I'm not talking mental health coaching, right? I'm just talking professional coaching, work-focused topics, right? Because in the end, a survey said that 93% of employees agreed that the companies that survive COVID, which will not be obviously all of us, you know, those employers that supported an employee's mental health will come out stronger. And so again, the value of taking the time. So we're going to talk a little bit quickly about some of the big agencies that are really involved in this, right? From an HR standpoint. Certainly there's a CDC from the medical standpoint, but OSHA has a page of regulations, and some of those are specific, obviously, to reporting and following out whether or not, right? I mean, here's the question. You know, we heard a little bit about the ADA, and that's protected, if you will, under the EEOC, and certainly the Department of Labor has been busy not only investigating employee complaints, but also leveling fines and penalties against employers who are not doing what they need to do under the FFCRA. So one of the things, and again, differs somewhat from medical privacy, right, is what do I do with these health records that I'm collecting on my employees? So those temperature screenings that you're doing is considered a medical record, and it must be maintained. And here's the kicker: under OSHA, it has to be maintained for 30 years. So, and I can't see raise of hands, but who's doing that themselves versus using an app to do that, right? Though the app costs you money, the digital maintenance of those records, assuming that it's well protected, right, is probably a better way to go than your sheets every day, if you're keeping a sheet every day of an employee's temperature. So on the COVID diagnostic tests, right, again, it's a medical record, and it must be, if you send somebody out, and I don't know how you guys keep your exposures, but you all know, a needle stick, right, is an exposure, if you will, is, you're going to need to keep those records in some capacity for 30 years. Bit crazy, but that is what OSHA tells us. Then so absolutely you can do both of those, right? I would add that if you send an employee for a diagnostic test, not only are you paying for that diagnostic test, specifically if they don't have insurance, because insurance is paying 100% of those, or should be paying 100% of those, is that you will also need to pay for time under the Fair Labor Standards Act. So you send Mary to go, right? Mary's time to go is then compensable time. And that would be true if you were using a second confirmation test. You know, she's at home and is going to get retested. That time would be paid time as well. At this point today, the antibody testing is not permissible as a screening to return to work, simply because the validity has not been proven. And we won't even talk about DeWine's false negative. And then how quickly he got 2 tests within 24 hours and got results back so quickly. If you listened to his press conference yesterday, he was taken to task on that, because the rest of us, right, are waiting 5 to 7 days. Though I did see a report this morning that says the national average is down to 3. Yay. All right, so let's talk about a couple of situations that if you, either symptoms of COVID or has been tested positive for COVID, some things to consider, right? So if they got sick but not tested, is that you want to be able to keep them out of the office for 10 days since the symptoms first appeared. They also have to have no symptoms for 3 days and no fever for 24. So there's a couple of different hoops that have to be jumped through. Now, the CDC has come out most recently, again, as of Monday, and said to us that if you're in the healthcare area, that they are still requesting that if somebody has mild to moderate symptoms, that they quarantine for 10 days. Remember, it used to be 14, but now it's 10. And they do not put a days of improved respiratory symptoms. It's just, they say there's no time limit. They simply say that their respiratory issues have improved and that there is no fever for the last 24. If somebody has been tested for COVID for some reason, for maybe just continual screening processes that are happening, but asymptomatic, the positive COVID test is 10 days since the test. That somebody should self-quarantine. Now, what I would say, because you guys are essential and critical infrastructure personnel, especially your healthcare providers, is to figure out, can I move them immediately to telemedicine, right? And so it doesn't mean they may still be able to work. We just need to make some accommodations for that. So, before we run out of time, and I said Lynn, she could certainly pass along the slide deck to those that participated today, but did want to talk about the school situation. So that's not specifically covered here. So I'll leave a couple of these things up while we talk about school. And actually, if in the end, it's pretty easy to make a decision as to whether or not somebody gets to exercise their FFCRA rights relative to school, is if the school is closed or the daycare is closed. If it is closed by either state order or local order, right, then the individual who has a child may be able to exercise their rights under the paid leave and the EFMLA, the Emergency Family Medical Leave, even though you are not over 50, likely in most of your practice sizes. So if there is no choice by the parent that they can send their child to school, then they're likely eligible. So if we have a school district that makes a decision, says, parents, you get to decide, school is open or you can have your child virtually learn. If there's a choice and the parent chooses virtual learning, then the employee is not eligible for the FFCRA and the paid leave under those components. So I know, if we end up at purple and the school's closed down, right, and parents can't come to work, right, eligible for the FFCRA and the 12 weeks, if you will, between the paid sick leave plan and the emergency family medical leave plan. So that's a very quick level. What question can I answer relative to situations that you think you might encounter?
I have a question. So for the FFCRA, if we tell them that they have to quarantine, they still are not eligible for it, correct?
So unrelated to school. So if
Right.
the employer says, I need you to go self-quarantine, you're not issuing an order, right? That has to be a federal, state, or local
Okay.
jurisdiction order. Now, again, when you look at the employee paid sick leave, advised to self-quarantine is by a healthcare professional. Now, you guys are in a unique position that, relative, one of your docs could say, right, that person needs to self-quarantine. But typically for most of the population is that we're going to go get a medical appointment and the medical professional is going to tell us whether or not we need to self-quarantine. So if somebody is then showing symptoms of COVID and you say, oh, you need to go to the doctor, then at that point, yes, the FFCRA rights and employee paid sick leave would be available to them, assuming that they followed through, went to the doctor, and is getting a diagnosis, positive or negative. And here's what I would say to you. We don't want to open this bucket up to every employee, right? And that everybody gets their 2 weeks, right? That isn't the intent of this. But the DOL has been very clear on the fact that they are sitting on the side of an employee if an employee makes a complaint about not being able to be granted their paid time. All right. Another key issue is, I'm not sure again who's over 50 in employee size, but if you are and you've already been following, obviously the FMLA, is that an employee, if they've already used some of their FMLA time for their own serious health condition, somebody else's birth, adoption of a child, et cetera, is that, and then they want to use 12 weeks for EFMLA, that is not how the math works. You get 12 weeks in total, depending on what your look back period is, in total of FMLA time, whether it's regular FMLA or whether it's EFMLA. So people don't get to double dip. I was on a webinar earlier this week that was presented by an attorney, and he said, and just beware, we know that schools, with them reopening, are going to be sending, we're going to see probably an uptick, and you all know that, you're in healthcare, we're going to see an uptick in positive cases. And he said, you're also going to see an uptick in December. And I'm thinking to myself, what's going to happen in December, right? We're all home, nobody's outside, no one's socially doing things. And his statement was, for those employees who did not use any of their time from April 1st to the last 2 weeks of December are going to say, it's my right. And we will probably see an uptick in requests for the utilization, because just like the $600, somebody else got the 12 weeks or got the 2 weeks of pay, and I didn't, and I want it. So again, just something to consider as we move closer to the fall and to the winter. Thank you. So I'll wrap up on that comment. So we know last week the federal court in New York said that though there is the carve out for healthcare service providers, i.e., right, physician offices, that you don't have to provide the FFCRA, the judge in that particular case said, not so fast. Healthcare providers, i.e. your NPs, your PAs, your technologists, your physicians, right, all the extenders, and maybe even to the MA, you could elect to not cover them under the FFCRA. What they were basically saying is that just because you're a healthcare practice doesn't mean that the entire practice doesn't have to follow the FFCRA. So if your front desk person or your biller gets sick, right, that court has said, not so quick, they're eligible. What we are waiting on, Mark, at this point is whether or not the DOL is going to acquiesce and support that decision. There was 4 decisions that came out of that court case. So that was just one of them, but acquiesce and say, yes, it's for healthcare providers alone, not the entire practice. or whether they will appeal. We're now, oh gosh, what's the date? We're now 6 days out from that decision, and the DOL hasn't come out and said anything. Now, if you actually go back to their guidance originally created in March and April, what they asked every employer to do, including healthcare practitioners and healthcare practices, was to be judicious in the utilization of the exemption and to look at these as a case-by-case situation. So depending on your risk and your how much risk you want to take on, I would suggest that you look at it as case by case, that you know, your doctors and your physician extenders may not be eligible for FFCRA, but that if your front desk person needs to exercise their FFCRA rights, then I probably would support them in that decision. But in essence, there's actually 2 exemptions that impact most of you, I would assume. The healthcare exemption, as well as being under 50 in employee size, that there are some things that you can do to say, oh, no, we're too small to be able, that if we would follow providing people and not have, if we would allow people to be off, then that would be an undue hardship and would basically close down the business. All right, well, as shared is that the PowerPoint will be passed, and if you, through your review of things we didn't get covered today, or you'd like to have a follow-up conversation, certainly you feel free to reach out to me either on my direct phone or via email, and we can chat.